start with the assessment, I will be gathering all my materials such as the goniometer and the measuring tape. So, good morning ma'am, I'm Rohanne and I will be your student nurse for today. So for verification ma'am, what is your name? What is your birthday? Okay po ma'am. So for today, I will be assessing you for your musculoskeletal system. And if you have any questions or concerns, you may tell me. Is that okay ma'am? Okay po. So first, I will be performing hand hygiene such as by putting alcohol in my hands to avoid spreading any microorganisms, and I will be also closing the curtains to provide you comfort and privacy. So before we start with the assessment, I will be asking you ma'am a few sets of questions regarding your health history. So first po ma'am, have you experienced or do you have any history or do you have any presence of any myalgia or muscle pain or muscle ache po ma'am? Okay po ma'am. So next naman po is, do you have any limitation in your movements or inability to perform your activities in daily living? Okay po. And have you had any injuries or do you have any injuries from doing activities such as sports? Okay po ma'am. Lastly, are you experiencing or have you experienced function lysa or the function loss without pain? Okay po. So let us now start with the assessment. Firstly po ma'am, I will be assessing your muscles. First, I will be assessing your muscle size, and I will be comparing both sides ma'am, and I will be using a measuring tape if I have noticed any significant difference between the sizes. So, okay, please hold your arms like this ma'am. So I'm looking at your most common muscles such as your deltoids, biceps, triceps, your quadriceps, as well as your gastrocnemius po ma'am. And okay, so upon assessment po ma'am, I have noticed that the muscles have a symmetrical in size, and there are no signs of any unilateral deviation such as unilateral hypertrophy or it is the abnormal increase in muscle size, and there are no signs also of unilateral atrophy or the abnormal decrease in muscle size. So going forward ma'am, now I will be assessing or inspecting rather your muscle and your tendon contractures po ma'am. So please relax your hands. Okay po. And please lay down. So I am observing the foot of the patient to determine if there is any presence of foot drop. So please sit down. So upon inspection, I have noticed that there are no signs of contractures. Contractures are the permanent shortening of the muscles or the tendons that may cause limited motion or limited ability to perform motion. And there is also no signs of foot drop or when the foot is involuntarily flexed downward po. So going forward, I will now assess the muscle po for circulation as well as its tremors. So I would like you to ask you to relax your hands and put your arms. Okay. So upon inspection po ma'am, there are no signs of involuntary muscle contraction or what we commonly known as the tremors. So either the resting and the intentional tremors are not present po. Moreover, there are no signs of spontaneous muscle twitching or the fasciculation po ma'am. Okay. Next naman po ma'am is I will be palpating the muscles to determine its tonicity. Can you please relax your hands in my forearm po? I am now palpating for the biceps, the triceps, the other side, as well as your quadriceps and your gastrocnemius. Okay po ma'am. So upon palpation po ma'am, I have noticed that the muscles po are soft, firm to palpate, and there are slight resistance, meaning that it is in normal tone. Moreover, there are no signs of hypertonia or spasticity. Spasticity or when the muscle shows rigidity and a bar-like resistance upon palpation, and there are no signs of hypotonia or flaccidity or when the muscle shows that it is too soft upon palpation. Okay po, so next naman po ma'am is I will be palpating naman po for your, so I will now palpate the muscles when the client is active and when the client is passive. This will help me determine any signs of further flaccidity, spasticity, and as well as the smoothness in the movement. Okay po. So, first I will be asking my patient for you to perform active movements po or by yourself. So, firstly, can you copy my movements? This po. So, do it slowly po, and I will be palpating your biceps as well as your triceps. And can you do this motion? Can you lift your legs up? Both your legs, ma'am. And slowly pull it down and continue to do so. Cut your steps and enter the restroom, please. So, upon inspection and palpation, I have noticed that the patient was able to perform the movements in a smooth manner, and there's also no signs of acidity or spasticity upon palpation. So, I will now ask the patient to perform passive movements. But of course, passive movements is initiated by the nurse. So, I will be touching your arms. So, please allow me to do movements and just relax. So, the patient was able to perform the movements smoothly without any pain or without any restrictions. So, going forward, I will now test the muscle strength. And I will also be comparing it from the right side to the left side, and I will be grading your muscle strength from 0, which shows complete paralysis, up to the highest, which is the 5. That shows that you are able to do the full movement against gravity and against full restriction. So first po ma'am, I will be testing the muscle strength. Your turn right down side. Go against my force. Okay, then your trapezius. You raise your shoulder. Okay po, and then your deltoid. Please raise your hands and go against my force po. And then your biceps. Go do this motion and then pull your hands towards you. Okay, and then push your hands towards you. Your side po. And then after that, I will be doing your hands. So I will be pressing your fingers together and go against my force. Okay, and do this now. Okay, so next naman po na is can you go in my position or lay down. So next I will be performing muscle strength in your hip muscles. So I will be pushing, so please raise your legs up and then I'll be pushing it downwards. Okay, hip abduction, so kindly spread your legs and go against my force. Okay, now close your legs for hip abduction. Okay, and then for the hamstrings, please bend your knees and then I will be pulling it, so restrict me from pulling your legs. So next naman po is I will be doing your quadriceps. So I will be pushing your legs upward. One. And then next naman po is your foot and ankle. So can you go against my strength, ma'am? Okay po, under feet. Next. And po. And lastly, for the grip strength po ma'am, can you squeeze my fingers po? Okay. So upon assessment, the patient was able to show that there are no signs of any unilateral weakness and that the strength is bilaterally equal. Moreover, the patient showed full strength, meaning that the patient was able to perform the full movement against gravity and against full resistance, meaning that the patient strength grade is, muscle strength grade is 5. So going forward, I will now be assessing po your bones po ma'am. So can you stand up for me to be able to inspect your bone structure as well as any deformities? Po, can you turn around ma'am? You miss it ma'am. So upon assessment, I have noticed that the spine is straight, the shoulders are leveled, the hips are leveled, the legs are straight also. There are no signs of any scoliosis, lordosis, or kyphosis, no signs also of bow or knocked knees, and no signs also of any bone knee protrusions, or also known as the osteophytes. So going forward naman po, I will be inspecting or rather palpating your bones po ma'am to determine if there's any swelling or any tenderness. So first, I will be palpating your facial bone, which is particularly your zygomatic bone, your clavicle, your humerus bone, and your ulna and your radius. I'll also be palpating your femur, your patella, and your fibula and tibia. I'll also be palpating your metatarsals and your metacarpals and carpals. So upon assessment, there are no signs of any inflammation or swelling, rather, and no signs of any tenderness. Did you feel any pain ma'am? Okay. So there are no signs of any tenderness, meaning that there are no signs, or this could be an indicative that there are no signs of osteoporosis or the weakening or when the bones become brittle. No signs also of fractures that could create that could inflame the surrounding skin, and there's also no signs of neoplasms or the overgrowth in tissue that could indicate tumors. Okay ma'am, so going forward, we will now be assessing the joints po. So first, I will be inspecting and palpating the joints for any swelling or any tenderness. So first, I'll be palpating your cervical joints, your thoracic, and your lumbar. And I'll also be palpating your shoulders. Tell me if you feel anything now. Your elbows and your wrist. And your knee joints and your ankle joints. So upon palpation po ma'am, there were no tenderness. So since there were no tenderness and there are no signs of any edema, this could indicate that there are no signs of osteoarthritis or the degeneration within the joint cartilage that typically affects the big bones and also causes inflammation within the joints. Moreover, there are no signs of rheumatoid arthritis or the autoimmune disorder that affects mostly the smaller bone but also causes inflammation within the joints. Moreover, there are no signs of swan-neck deformities within the distal phalanges. That is a permanent stiffness within your distal phalangeal joint, and there's also no signs of gout, which is the uric acid crystal buildup that in your joints. Okay po ma'am. So going forward, I will now be asking you to do certain movements po ma'am for me to be able to assess your range of movement and the ability of your joints to move. Okay po ma'am, so please stand up po. So please copy my movements for the neck, for the shoulders, and for the elbows, okay ma'am, for the wrist, and for the hips, and for the knees, for the ankles, okay po ma'am, and for the spine. So upon assessment, the patient was able to perform the full range of motion, was able to exert full range of motion without any pain and without any resistance in the movements. And moreover, I have heard that there are no signs of crepitus or the crackling sounds whenever the patient moves. And moreover, there are no signs also of any resistance to the movement. So that is all for our assessment. But before we end our assessment, I would like to inform you that the data recorded from our assessment will be recorded and that it will be kept confidential and will only be shared to other healthcare personnel that are directly involved in your healthcare. So thank you ma'am and take care.